Hi everyone, welcome to Business Showcase. We're here again today at Accent Plastic Surgery with Dr. Mark Craig.
Hey, thanks for being here.
Thank you for having us. So today we want to talk a little bit about the face and neck and some of the different things that you guys have here to kind of help with different problems that people might have with their face and their neck. So what is maybe the number one complaint that people have about their face or their neck?
Sure. So when you look at plastic surgery on the face and neck, the classic thing we look at is just a facelift. So that's what people say, well, I'm not sure I want that, I may want that. They kind of go back and forth with that. The things that we see really people complaining about from that is the eye and brow area. So with that, we'll kind of just focus in on a couple things we can do. So we have, besides surgery, the one thing that's nice about surgery is with the upper eyelids, a lot of times with visual field impairment, that actually the insurance will actually cover some of their surgery with that. So we can look at surgical procedures, we can look at Botox to treat around the eyes, the crow's feet area. We can also look at therapy to treat there. We have the sublative and sublime, the radiofrequency treatment that we talked a little bit about on Monday and Tuesday. So those are things that we can really focus in on. The other things that we look at is a lot of people now with, I think it's really with the cell phone cameras and selfies, we see a lot of people complain about the jawline and the neck area.
And so you guys have a lot of stuff that you can do to help there too, right?
Correct. So there's, from a surgical invasive standpoint, we can look at a facelift, a neck lift. We can look at liposuction under the neck. But a lot of people, if they're not really wanting to focus on that, we have two new modalities, really 2 to 3 modalities. We have therapy that we can use to treat that area, which actually is FDA approved for lifting. So that's in office, non-surgical. And no downtime. The other thing is we have 2 new treatments. We have the Cool Sculpting, that's the submental, or the Cool Mini, that actually causes the fat to go away, and also the new Kybella injectable treatment. So those are really good treatments for both.
Good deal. Now, for somebody that maybe thinks, I know I'm unhappy with this area and I want to see what option might be the best fit for me, do they just need to go to drmarkcraig.com and kind of read about them and then maybe schedule an appointment with you all?
Yes,
consultation?
It gets to be a little bit confusing because there's so much information. Some people don't know if they want to go invasive or non-invasive. So we see a lot of people make these multiple non-invasive steps, and we do a lot of combination therapy with people. So they can come in and make a consultation with me. We can sit down and talk with them and make a plan, and I think that's very important.
I do too. Thank you so much for joining us today. I have learned a lot, and I know you all at home have learned a lot. Make sure you join us again tomorrow for Business